interesting to hear the keynote by Mr. Sudarshan Jain of IPA. And one thing that he said, no, there is no room for compromise when it comes to pharmaceutical products and supply chain for the healthcare industry in the world. I think it's a profound topic amidst economic nationalism. What is the role of the supply chain in serving the global healthcare needs? We will try to make some sense of this. This is happening in the midst of trade tariffs, increasing nationalism, nearshoring, diversification of production. All of this is actually going on. And I think the dynamism and the speed at which these things are happening is quite unpredictable. Today, the decisions that you make in your businesses depend upon what has happened in the last night, maybe the other part of the world where it has been working. So it all depends on the geopolitics. It all depends on how the politicians actually run the different parts of the world. So there is so much of uncertainty, and I think COVID has taught us actually how to deal with this uncertainty. All of this may happen, but then that's not an reason for us to stop doing business. We have to continue, as someone said, and this is a common phrase, and I think one of the last sessions that the FedEx founder attended in Miami, one of the conference had said, water will flow where it's supposed to flow, and it hits a rock, it will take a turn and move around the rocks. And I think COVID has taught us, all of us, particularly healthcare and the logistic, I think the champions of the pandemic. So perhaps probably we are maybe a little more better prepared for something like this. Uncertainty is something that we go to live with it. We also see that the global healthcare supply chain is being reshaped by a potent mix of trade tariffs and geopolitical tensions. This is actually leading to what they call is a China plus one, China plus two, China plus 1x. So these are things that are actually are realities, and we are living with that. We also see that these are also a pride for the nation, or these are national assets to some extent when we look at critical industries like pharma, semiconductor. We have seen how countries have really taken extraordinary caution and attention to some of these sectors. We have seen how the US government actually took a 10% equity in Intel because they really want to control the design and the production of chips, because artificial intelligence and application of that is actually proliferating the use of GPUs and different types of semiconductors used in those industries. We have also seen during the pandemic, because of the economic might of certain nations, they were able to stockpile vaccines because much more than what they needed, forgetting about the other parts of the world which did not have access to probably some of these things. I think these are very important questions that we deal with on a daily basis. Perhaps what we are going to hear is from the pharmaceutical manufacturing sector, supply chain, logistic, procurement head. We have two people. We have Anshul and Amol talking from the pharmaceutical manufacturing sector. And then we have the other set of people who are actually providing the logistics service to the pharmaceutical industry. So we are trying to kind of understand and make sense of the threat of tariffs on pharmaceutical industry. We still do not know what exactly is going to be or what the reality is. With this note, probably I'll just open up for everyone to have a quick comment on this particular topic, and what is the sense that you make of the current scenario, and how are you picking up this information, and how much of that reality is there in terms of what we hear in the news. I like to keep this conversation as interactive as possible. We've shared set of topics for us to discuss. Um, but keep your responses very brief to the point so that we can take more questions. And maybe at the end of the session of the 60 minutes, we also take a couple of questions from the audience if there are any. Uh, Maybe let's listen to the pharmaceutical industry representatives. Maybe Anshul, you would want to start. What is the sense that you make of trade and tariffs and geopolitical tensions, and what is its impact the industry that you represent?
I'm Anshul Agrawal, taking care of supply chain strategy at Olon. So we are a global API manufacturer, so headquartered in Italy. We have 14 API manufacturing sites and India is one of them. So coming to the questions on the global tariff war, so this is the reality. We need to face it. And our company is also not shying away from this. We have to deal with it. So we being a global pharma company, we have our manufacturing sites in Europe, US, and India. So we are trying to optimize our manufacturing capacities and we are redesigning our supply chain, how to navigate these changes. So we have advantage of producing in different countries and we also have a lot of contract manufacturers we work with. We have our vendors and logistics partners to deal with this situation. So in nutshell, we are redesigning our supply chains and we are trying to work collaboratively with the big pharma companies. So now the big pharma companies are also, kind of started redesigning their supply chain. They are talking to us like we are the vendors for them. So reshoring, nearshoring, these are the words we have already started doing it. So at this moment, the discussions and the planning phase has started, and we have moved to the planning to piloting phase on these topics, but definitely a lot to come. So
Thanks.
these are my initial remarks.
Yeah, Amol, what are your initial thoughts, and what is the sense that you make?
Not a different thought what Anshul said. This is a reality. The tariffs are today or tomorrow. There would be some kind of an implications happening on those area. But as a pharma company, we have to be very much agile and with respect to the change management, we have to be doing this the speed at which what we want to work. That is a key to get into those kind of a market. I agree completely that we have even we have manufacturing facilities at US, at Europe and India as well. So we have to leverage all our activities and supply chain, considering what kind of a products we want to market at which areas and market. Based on that, we define our manufacturing strategies. With respect to that, the supply chain also changes. We have identified our vendors, our API manufacturers, our excipient manufacturers who can supply to those areas, to those regions. And it is not only we are focusing now from cost-effective manufacturing setup to the resilient and agile manufacturing setup. That is where we are focusing now. And accordingly, the entire planning module, demand planning, our business team is also reaching out to our customers to route all our products to those kind of regions and cater to the market based on our activities. What best product range we manufacture during those manufacturing setups, those kind of a formulation, those kind of a product we cater according to the requirements. So that is how it is evolving. Though it is at early stages, but I think so we are geared up for that.
Thanks. Giri, what are you noticing?
So if it's a good question. I mean, if you look at the current market conditions, as of today, the US volumes are not yet gone down. It's kind of pretty stable at this point of time. But the market sentiments are expected to go down. That's the feedback and everybody's saying. What I understand is, shippers got good amount of inventory to the buyers in US. So that's the reason why they are currently sending, whatever they committed to the buyers. Those volumes are currently going on. We have to wait and watch, at least for the next couple of months. We need to see how the market trends or if there is any political changes happens between India and US. Based on that, I think, the market will pick up. But US is certainly a largest market for everybody. I mean, nobody can avoid US lane. So we are hopeful that things will be in place quickly, and then this momentum will continue. Rich.
Thanks. Yes, you have exposure to good amount of pharmaceutical volume from India. What is the boardroom discussions on the current geopolitics and the trade tariffs?
Reggie, first of all, very interesting presentation from Mr. Jain. And what I would like to say is that we all heard the phrase survival of the fittest. I think what we need to add now in this world is the strongest will thrive, which is very essential, and which is what we see today, that there is a very strong sense of dominance which is being spoken about, and each economy of the world is trying to show in which area are they dominant and how can they possibly alienate some of the other powers around the world. So what is very essential for any economy, any country in the world is to create that area of dominance in this world. Because if you do not have a segregator, if you don't have a separator from the world, you will have a challenge. So I think that one of the biggest separator for us is pharmaceutical industry. And this is something that we need to realize that, when we're talking about $2.9 trillion getting invested in a defense, in defense around the world, how much our country invests in the pharmaceutical industry to stay in the front, because we are 40% of the world's generics, we are almost 60% of world's vaccines. So we are in a state of dominance in terms of pharmaceuticals, which is why the tariffs are not yet imposed on us for the pharmaceutical industry. We must continue to remain very relevant in this area. The world will remain very, very fragile. Over the last 100 years, probably we've seen different challenges that have happened. COVID brought about a very, very strong word, which is adaptability, and the ones which are able to adapt quickest to those kind of situations were the ones who survived and thrived. I think even now, with this tariff world, what is very important is how well India will adapt to this, whether it is in terms of bringing the APIs from different parts of the world, whether it is about creating a even stronger API infrastructure ecosystem in the country, and making sure that your end produce reaches out to the world. Lastly, the logistics world needs to make sure that we are able to adapt to these very changing, very strong and quick changing environments, which the logistics industry is doing pretty well. We are adapting into whatever need that is there, whether in terms of air freight, whether it is in terms of warehousing, whether it is in terms of ocean freight, or even inland distribution. I think the logistics industry is doing well.
Yeah, from Charles Darwin's survival of the fittest to survival of the strongest. Maybe I must add that it's also survival of some sort of a convenience, actually, because if you are the strongest or you are the pharmacy of the world, probably they know that a lot of the rest of the world depends on the medicines that you produce here. Therefore, it's convenient for the others not to put a tariff on those things. Manoj, I believe you have a lot of time now as you venture into your next role. I'm sure that you must be consuming a lot of news. You have enough time. What is the sense that you're making of geopolitical tensions, trade tariffs, and the impact on the global pharmaceutical industry and the supply chain?
Okay, good morning, everyone. Good to see after a year this global pharma summit. It's increasing, and it's a lot of collaboration with all the stakeholders together. So, great event, Reggie. As always, your questions are like, we tend to understand that what question would be like a examiner asking questions to the students, what would be the next. So
I
think it's a very so to discuss about this, I would take a little bit more on the backyard. Nobody knew about COVID, right? And when the COVID came in, everyone was panicked. A lot of deliberation happened. A lot of strategy came in. But we survived. And hats off to our industry, and especially the pharmaceutical industry, came out with a lot of solutions, a lot of options. And the logistic players, supply chain players, came out as a collaboration. The airport to all the supply chain players worked together. And we made it a success story, right? Across the world, it's not about India. Now the new definition of COVID to coming to tariff, I'm sure nobody knew before what tariff was, an impact. So everyone is talking about tariff. This is a new thing which is now since last 2 months. Even the school-going children is asking about what is tariff. The curiosity is moving around the news across. The world is moving into, as what Yash mentioned, exactly to the point that the dominance is the most important aspect. Now, if you see from our India's export perspective, from the value-wise, we have moved in around $8.73 billion of medicines across the world, to US especially, and the generic goods, as Yash mentioned, we dominate the market in the world. Now, when you see that this disruption is going to come and this kind of fear factor comes in, I believe we all have to work the way the other country works on their dominance. If you see China, the rare earth, they dominate around 75% of. And what they've done is, do not see that they have only the material. What they have done in last 20 years is about diversifying, creating a best of the technology, best of the production. They have got in-house, they're not dependent on that particular rare earth to other countries to dominate, right? They did end-to-end solution, and that's the reason, if you see there are 7 industries working on, dependent on China. So they are in the dominant market. When you talk about Russia, of course, second in the world to produce 70% of the oil across the reserves, right? When it comes to our country, it's all about pharma, which is, we have evolved. We have made it very good in terms of our dominance. But what needs to be done is the next, in case of this fear factor comes in, of tariff coming across, we need to work in tandem with what China has done. So we have to look into a supply chain disruption. We need to look for other resources, which will really curtail the cost. The time factor is important. The supply chain player will keep on giving solutions to the key players. But on the other side, it's important to have what could be the next alternate. You could have your entire, either you do an outsourcing to other country where it's cheaper so that you can compete. Now, when we talk about India and the pharma, China also on the API is trying to dominate us. So what needs to be done, if you see the difference between a tariff, which maybe, you look into the worst scenario, if there's a difference between 15 to 20% of the variation in the tariff percentage, we still survive. We will be the market leader. But we go beyond, I think we'll lose the battle. So it's very, very important. It's very, very clear that this is a temporary phenomena, but it will help us to sustain that. What could be the worst scenario? We work what other country does it. So we have to work on our diversification, curtailing the cost. You have to work more on research and development. That's the most important. Because the more you do a research and development, your activities on certain products will be a dominance. Because India is known to do a lot of innovations across. We have done so many in the past 100 years. So we focus on research and development, time factors, solutions on diversifying our cost into a different solution. The resource, maybe you can get it from other countries to curtail the cost, to compete in the global market, right? So from all aspects, and then when you talk about the supply, the logistic players, we always give solutions. We've seen what we're in COVID, everyone, right from the airport to the freight forwarders, to custom brokers, to the transporters, they have given solutions out of the way they've gone into. Of course, we maintain the cost. So there are 2 important aspects. You diversify, work on the time cost factors, and compete in the market that you, even in the worst scenario, how best possible we can give the market leaders. So for what I see in the next 1 year, there will be new alternates, new ideas, and new thought process have come to India that we will spread across in not to dominance in one particular region. So that's where I believe this is a learning lesson to us. It's a blessing in disguise for us that we have all pulled up our socks, that during the challenges where we had in COVID, we dominate the world by giving medicines to across 70% of the population of the world. So here in pharma also, dependency is there. But how do we compete and maintain the market leaders? I think that's where we have to focus on.
Yeah. Remember that India dominated the API market once upon a time, and then we lost that market to China. And at the time of COVID, when China restricted import of APIs into India, then India realized that it is time for us to again get back to API. Dharmesh, as a representative of airlines in India, what are the things that you are watching, and what is the sense that you make of it?
First of all, a brief introduction. I am Dharmesh Rami, working for the best GSSA organization in India, Global Aviation Services Private Limited, for past 32 years. Global Group has been servicing the aviation and cargo industry for over 5 decades. Uh, so I would say, Reggie, it's a privilege to be here with such a distinguished panel. Thank you for that. Uh, Talking about the topic, I would say Mr. Jain actually pinned it very nicely in his opening address. You know, while the world was talking about economic nationalism during the COVID period, India stepped forward and, you know, uh, if you even compare the cost of the medicines, the 2 billion medicines for 4 billion compared to 2 billion medicines for, you know, 70 billion, that's a huge thing. I think as Indians, we evolve very fast. As Anshul pointed out, we have already taken steps to move to the next. We anticipate the future trends and we make moves before the rest of the world even, you know, they react, but we, you know, possibly preempt the, the trends, what is going to happen in next, and we prepare ourselves accordingly. The logistics industry also has, I think there's a lot of changes happening in the logistics industry in India. Basically, if you're going to see, there's a lot of investment coming into logistics, right from warehousing to even the company, local companies are getting into digitalization and everything. I think we are poised to play a much larger role in the world, you know, not only with pharma, but also the pharma-related logistics.
Thanks, Dharmesh. Harish, as a cargo handler, cargo terminal operator, one of the most congested airport, Pharma is a big portion of the volume of export from Mumbai. What are you reading?
Yeah, thank you, Reggie, and good morning, colleagues. As you said rightly, pharma is a very important product for us in Mumbai, in fact, for India. That's the reason that we have a separate dedicated facility, a state-of-art facility, which has the current environment itself, we are using at a 50% capacity. We are mindful of the changes which are happening out here. Unlike in COVID, the situation, everybody, it was a collaborative approach. Everybody, it was a survival approach. So everybody collaborated so we could find solutions. But in this kind of situation where the uncertainty which is there, which is unexpected, like 6 months back, everybody had a good focus towards US. US and Europe are the major countries where we export, not only pharma, but other products also. For Mumbai per se, you can say that, pharma, yes, and then the second followed by auto parts. Okay, even auto parts, you see that a lot of tariff being applied. So in this kind of certain uncertainty, we are mindful that, the manufacturer, including the pharmaceutical companies, would realign their output for 2025, which is quite natural, unless there is a settlement of tariff, which we are seeing that it is happening. Because otherwise, we are mindful that there would be some pressure on this output, and that would immediately affect the cargo which is moving out of Mumbai and the other stations. So we are working closely with the shippers and forwarders and seeing that what can be done and help them to realign their processes internally, and whatever best manner we would able to support. But as of now, there is not much changes we are seeing. But I think if this continues, the second quarter will be difficult. So let us wait and watch what's happening on the ground.
Thanks, Harish. Ulrich, the last word for the first round of questions to you. You part of Bangalore International Airport, part of WFS, another cargo handling terminal operator. Bangalore is the fastest growing airport in the country in terms of the numbers. It's a gateway for southern part of India. What are you picking up?
Well, tariff, first of all, thank you for having me here, Reggie. Tariff has been the new buzzword. The initial days, it was volatile. The key word is like how Yashwalji just said, adaptability. We did have to do a couple of freighters within less than 48 hours notice. We adapted. The best part of being in India, and being Indian is we adapt.
We
And the entire industry has shown how it's been adapting to the volatility. But to echo what Giri said, as of now, with all the relaxation and with the exemption on pharma, it has kind of settled down. We haven't really seen major surges. We're gearing up to it. Plans have been made. But at this moment, we're in constant touch with our forwarders, the key forwarders that move pharma, and we are planning it on a day-by-day basis.
Thanks. With the first round out, question to both Anshul and Amol. As a procurement leader for Amol, you've been there for almost 2 decades plus. Leader, how are you navigating your supplier ecosystem in the current scenario of tariff-driven reshoring and nearshoring? Are there something serious being planned because of the potential threat of this that could impact your manufacturing supplier ecosystem?
So based on the current scenario, definitely we have changed a lot of strategies with respect to the procurement part. Earlier, we were a typical cost-driven procurement function, which is now, I think so, that is evolved and changed a lot post-COVID. And I think so that has helped us to not only think about the cost effectiveness, but also how the risk diversifications or how we have a resilience part with respect to the procurement activities. The focus is more on those, wherein we have the stability about the supplies, from where we want to procure the materials, the shortest lead times, that plays the critical role. While we were always working as a post facto work, so now we are moving into a predictive procurement activities. And thanks to AI and digitization, I think so that is playing a very, very critical role, wherein we have a lot of AI tools available, wherein we do a lot of predictions about the supplier capabilities, capacities, how they are coping up with the speed. I think so that is one of the areas of the focus for the entire team. It is not only about we call for the quotations, get it and supply the material, but it is about the total cost of ownership. It is about whether how cost effective that becomes the critical role. But we would be more focusing on the supplies continuity, smooth functioning, wherein the regulatory compliance becomes very, very critical when it comes to the tariff part. If suppose we want to focus it only on the US part, so we need to have those kind of vendors or the partners during our supplies. So we have identified all our partners region-wise, the category-wise, whether it is an API manufacturer, how difficult, easy it is to shift from a region. Maybe if all the suppliers are from Asia region or Europe region, is it possible that we shift some of them to the US region or Europe region, and then we cater it from there? So that activity is happening. Also, that is not very easy because of the regulatory compliance, but that activity, that mapping, risk mapping is happening. And thanks to the digitization, so that is where a very, very important factor comes in, about the complete chart is prepared for our vendors about their product range, their byproducts, their lead times, their capacities, where are they sourcing from, how is their logistics happening. So entire mapping is happening, and based on that, so the decision making is becoming much more faster. I think so that is a very, very crucial part which we are focusing more on currently.
How geographically spread is your manufacturing centers?
So it is across globe. We have at US, we have at Europe. We are procuring it from India region majorly, from Asia Pacific. So we have scattered and we have identified right kind of vendors, partners at those regions. Like if we talk about uh, uh, the chemicals, specialty chemicals, we are getting it from Europe majorly. If we talk about the APIs, we are doing it from Europe. If we talk about the excipients, there is more from US. And if we talk about more intermediates or KSMs, that is more from India region. Of course, China is already there, but we have now started China plus one. Make in India is one of the major concept which is bringing on. I think so that is helping us to be secured, and I think so we are helping the entire ecosystem well.
So as I understand, there is a kind of rearrangement of your supplier base closer
Yes.
to reshoring.
Absolutely.
Very closer to the, so
Yeah.
that's something that's already happening.
Yes.
Okay. Anshul, again, what he said about the from cost-centric to risk-centric supply chain models, perhaps prioritizing stability over the lowest price. Is that something that you notice? And is that something that's happening already?
Yes, definitely, definitely. So just to share an example with all of you, recently we are in touch with the two big pharma giants, top 10 pharma companies have started talking to us how we can help them to navigate this kind of challenges. We being having manufacturing capacities and facilities across the globe. So we are trying to leverage that advantage. And when it comes to optimizing it, as Amol rightly said, it's all about the not only the cost of raw materials or cost of freight, it's the total cost of ownership. So that's where the logistic partners role is also important. When we do the scenario planning, if we start evaluating the sources, source A, B, C. It's not only about the raw material cost or the what we are going to trade. What is the landed cost? In terms of raw material cost plus tariff plus freight. Everything put together, and that's where the decision making happening. So it's not only now you give the order to the lowest bidder. You give the order to the supplier who poses the least risk, who give you the best supply security. The decision making is happening on that. And SOPs, we are building the SOPs around that. Earlier SOP says if your cost is minimum, you have to give, otherwise take the approval of HOD or take the approval of CEO. No need to take the approvals of CEOs or CFOs. Our SOPs are defining that based on the risk assessment, based on the supply security, based on the resilience factors. The people are empowered, the guiding principles are there, so that they can take the decision in the best interest of the supply security. And as we always say that supply chain people, especially the supply chain, they are like ants. When you see an ant, if you put a barrier, the ant will not stop. They will find other ways to navigate this. So I would say all this geopolitical uncertainty, these are the barriers, not the wall. This cannot stop the show. We will find ways and means to navigate this, which every one of us doing. And as a company, as a global pharma company, we are also started taking steps, and we are moving to the next step.
Okay, my question to the rest of the panel members from the logistic fraternity is there a realignment of your service level agreement? Perhaps it may be a bit too early in terms of the current scenario that we are looking at, but given the condition that we have about information availability, scenario planning, because of the use of, there's so much of information that's available, and you have today tools to actually predict what he says. It's not an evaluation of what happened once the thing has happened. So you can actually, to some extent, you can predict. If that is the case, are there already discussions on these lines in terms of revising, realigning your service level agreement with your customers? Maybe Giri, and then
Sure.
followed by forwarder. Yes.
Yeah, Reggie, I mean, if we are completely in line with the market dynamics. So what is happening is if you look at our network, recently we announced we are expanding to 20 new destinations, which is coming up the span of next couple of months, and also we feel technology is the major factor. So during the Air Cargo Munich, our CCO Stanislas Brun introduced something called a tag and track. It's more like a thermal sticker where you can peel off and then paste it in the box, and then it tracks starting from, the time you paste it till the time, it reaches destinations. It gives a 360 degrees view in terms of, in case if it's a tilt or, in case if it's a temperature cushions, and then even the system will throw you inputs, even the shipment is on the flight. It's kind of, mapped with the flyware technology. So there's a lot of technology advancements, Etihad is focusing right now, and then we are well aligned with the pharma customers and try to support them and opening up a lot of new gateways. So we kind of, well aligned in terms of, catering to the needs of the customers right now.
Yes?
Well, Reggie, there are constant discussions with customers, not for now, but forever, on what are the possibilities to bring about changes in the service levels, whether it is in terms of technology usage, whether it is in terms of technology integration, whether it is in terms of the kind of infrastructure, equipments that logistics companies have. We are very, very regularly having these engagements with our customers and discussing what are the possibilities. With the advent of AI today, there are n number of technology tools which are available especially for the customers, where they can, right from the tendering process to evaluating how the entire journey of a consignment or probably set of consignments has been. These technology tools are very, very well available today, and there are certain tools which are sitting with logistics companies. There are certain independent tools available today where customers can plug in, the logistics companies can plug in, and even other service providers can plug in. It is just the use of technology today which is, I feel, is a very big differentiator. It is not that the tech is not there or the tools are not available, but it is the inclination and the actual adaptation by each stakeholders to use those tools, which is very, very critical. So the tools are available. Certain set of customers I really appreciate. They really work alongside logistics companies to see what works best in their favor. Because, like I said, the more time and investment that you do in research, you do in aligning your vendors with you, the more efficient the customers will become. Because we are all part of an ecosystem, and unless we have a trucker who's well aligned into the entire chain, who's working absolutely seamlessly, a custom broker who works seamlessly, a freight forwarder, any other service provider, equipments, active equipments that the customers need. So all that needs to be well aligned. So I really recommend to a lot of customers to spend quality time in doing this research as to how they will align the entire ecosystem and not just say one service provider. So that's the critical piece for me, and that will make sure that you have lesser problems to deal with. It's that one problem that makes you work on yesterday's work. It's always good to do tomorrow's work rather than yesterday's work. So I think that will happen when the customers understand the need to engage the logistics service providers more than a lot of times they do now.
Okay, question to Ulrich and Harish. As a cargo handler, are you using more of technology to understand what can be expected, or how integral is technology tools, artificial intelligence in your operation, in order to make sure that when black swan events like this happen, that you're much better prepared?
It was for me or you?
For both of us.
Yeah.
Harish, go.
As I echo Yash's thought that, technology is a savior for us. AI will help us to, manage this kind of uncertainties. We are at the gateway, okay? Freight forwarders are actually directly engaged with the customers and shippers. Their requirements and forefront is actually coming to freight forwarders, and then their demand comes to us. So we are aligned, okay? We are ready to align with whatever changes required with respect to the shipper is concerned, and the need of freight forwarders. But as of now, at this current stage, we don't see anything coming up, because as you know that everything is settling down. AI tool today, the good part is that there was a time that if you had to have a provided technology solution to any of those processes or towards it would take months' time. But with the help of AI and blockchain technology, now it is doable within few days also. There are certain things which are available on offshore and plug and play, which is helping us to resolve many issues on ground. So that will be a savior for the terminal operator also. For that, we foresee that, and it will help us a lot to manage this kind of situation. So we are looking forward for all the requirements from the shipper and the freight forwarders.
Okay, so at the WFS, member of the SATS Group World, operations excellence is at the helm of what we do in terms of the entire operations planning. So what do I mean by operations excellence? I have a bunch of engineers who are actually engineers in the logistics world, who actually do continuous improvement plans and resource planning plans on a weekly basis. This is aided with a strong dashboard that we've internally created for our network, which has a lot of calculation matrices that we do based on the flow of cargo, based on the tonnages, the number of pieces, and the adequacy of the number of people that you need to have to handle the continuous changing trends. If you see, the markets have been volatile in the recent past with all the buzz that's been happening, and this has only helped us stay ahead of the game. So what's the need of the hour? Flexibility. How do we get the flexibility is by these able dashboards that we have created internally with the help of AI and predictive text that we've been using on our entire MIS reports, and that's how we've been coping with the current situation.
Since we are talking about the decentralization of manufacturing, and can that really replace centralized global supply chains that used to be the earlier rule? Today it's about nearshoring, reshoring. Dharmesh, can decentralized manufacturing truly replace global supply chains?
Two distinguished members of this panel have already pointed out. I think we are already moving in that direction, and decentralization is very much a part of the process, wherein it not only helps us, reduce the risks of geopolitics, it also helps during the closures due to pandemics or any port closures or any other event. At the same time, I would say decentralization is more complementary. It is not an absolute replacement of centralization. While regional responsiveness to decentralization actually enhances regional responsiveness, but at the same time, you cannot apply it for all drug types. They may correct it if I'm, there are certain drug types which require, high-tech biologics or niche APIs. I think that would still remain to be centralized. Besides that, you have to take into consideration the cost factor, as Anshul has also pointed out very clearly, that the landed cost is what is the most important part of the whole process. So cost is one thing, availability of the trained labor, the regulatory compliances, and the most important is the quality consistency, which is the bottom line for any drug manufacturer. So I would say, looking at both the pros and cons, a more hybrid model is ideal, wherein we go for a centralized system of manufacturing for the high value drugs and more decentralized system for generic or OTC, kind of thing.
Thanks. Manoj, when you listen to all of these comments, and you come with several years of experience in the cargo operations in some of the major airports in the country, what are some of your reflections in terms of use of technology, getting that insights from the information collected, and then use them as the actionable insights? Is that something? What are your reflections on that?
Of course, the technology plays a very vital role. I think every airport, the terminal operators have their own system, cargo management systems, community system, which is now creating a great value. If you see what Mumbai has done, other airports have really evolved, trying to connect. So today, technology definitely plays an important role. If you see what it was 10 years back, it was all about a very silo operations of, terminal operator had its own setup, the freight forwarder had its own systems, then you had the supply chain players and of course the exporters, they had their own system, but no integrations was happening. But there are ways and means to really integrate together, and there are softwares available. There are airports trying to be proactively connecting together. But for an airport, let's talk about three aspects. One, from the airport, it's a finished product which comes to the airport. You operate, work on the operation excellence, try to handle it based on the SLA with the airline, try to deliver the product, vice versa. But all that happening of the process within the terminal is all integrated. You connect with the airline and the freight forwarder, you keep informations. It's very important that the freight forwarders also connect with the airport operators so that there is a clear clarity of transparency of the process. Now this is about the shipment info, right? But it's very, very important from the shipper's perspective as well to give what could be the forecasting for the next 6 months, 3 months, 4 months. The reason is, with kind of changes across the geopolitical environment, they will have to really consolidate and share with the logistic players that this is what we are trying to do. This would be our change of your process where our volumes are. So there has to be a clear communication channel from each supply chain players, right from the manufacturers to the end at the airport. I'm talking about air cargo industry. But the same thing lies with the shipping lines, because resource planning, what Alric mentioned about, it's the most important that end of the day, we are all trying to curtail the cost, bring in excellence, bring in transparency, and it reaches the destination is the key thing. So for that, technology, I think it's a future. I think we are in that process. We are doing very well on the digitization of, and the digitalization also, both. But today we have to go beyond, because this environment of uncertainty, it's very important that how do we communicate digitally so that we get all our planning resource. If you see any industries which has grown, the IT industries have really developed that particular product, that their process of movement of the goods have evolved and done very well. So I think not only the airport, I think everyone has to really work together on the digital.
Thanks. Question to Amol and Anshul. How intense has your interaction with your logistics service providers have become in the context of trade and tariff? I remember during the pandemic, there's been every forwarder is waiting for information as to when is the vaccine to be coming out. I remember doing a panel discussion, and everyone wants to know, but how will we prepare ourselves to distribute several billions of doses of vaccine? So how intense is your engagement with your logistics service provider in terms of planning such scenarios? Amol?
So yeah, it is very, very intense, and the most important factor is that why we are so much intense and discussion with our logistics and the supply partners is because we are catering to the patients, and we are, as a patient-centric organization, we want to deliver all our goods in the most safer and safest manner to the patient who would be consuming a drug or consuming a medicine. And that becomes the important factor for us to have a lot of dialogues with our freight forwarders, the logistics partners, that it is not only about delivering a good somewhere, but it is at the right quality with the right temperature sensitive or in a right condition, in a right packing, how it is required, what kind of a protocols we need to follow. That becomes very, very critical. And speed becomes the most important factor. And when it becomes as a patient-centric, it is not a responsibility of only a drug manufacturer, but the entire supply chain. Each and every stage, it would, if they take it as a responsibility that it is reaching to a patient, and if anyone can even curtail it by a day, a few hours, that will reach faster to the patient. I think so that is the key message to all the segment, that how collaboratively we can work towards it. And wherever, if it is possible, to reduce the timelines, how fast, effective, and in a cost-effective manner, if we can reach out to the customers, I think so that becomes very, very critical. And in and around those, what is required for that to happen, whether we need to define certain kind of an SLAs, turnaround times, or we want to make some kind of an agreements, uh, uh, any kind of a legal documents, any government authorities are required for that to come into picture so that we make it more faster. We see a lot of, maybe Harish can talk about that, we spend a lot of time in documentations, approvals, and the systems are down. So that becomes very, very challenging efforts for a organization to know where we are standing currently, when it will reach, how the movements would happen. I think so. Those all, if we think about it, and that is where digitization, AI, predictive analysis, I think so that will help us and build up much more faster, I think so, reaching to the patients.
Anshul, how challenging is that this constantly intense engagements with your logistics service provider?
Yeah, some of the points which Amol mentioned are common, but definitely the interaction has improved and improved a lot. You know, earlier we used to have SNOPs with our customers. Then we started doing with our vendors, and now we are doing SNOP with our logistics service providers. So, you know, gone are the time when we used to call a logistics service provider when I have to move my goods from point A to B, or if my goods are coming, inbound or outbound. Now, if there is a geopolitical instability, if there is a Red Sea event kind of thing, I also call my logistics service providers, as an expert in the industry. What are your thoughts? How do we deal this situation? Let's meet after 2 weeks with your thoughts and our plan, how what we are doing. So it's more of a collaborative approach. We look to them, our logistics service provider, to give us more visibility in terms of my shipment is on the way, and then if there is a political instability in that country, what are the options I have? No, not only to deal that particular consignment, but the consignment which are in the pipeline. So really, the interaction has improved a lot, and discussions are improving day by day, and that's where the expectations are also increasing. As Manoj said that we as a manufacturer, as a shipper, our responsibility is to give them the more visibility in terms of our plans, our forecast, and in turn, we also expect logistics service provider to give us more visibility in terms of our shipments, tracking, visibility, securities, what are the risks in coming ways. So, for example, when we prepare our budgets, we do consult our logistics service providers and our vendors. How do you see the situation evolving in next 1 year's, 2 years time? So this is how the situation is changing.
Okay, before I turn to the audience, to take one or two questions, one last piece of question for some of the logistics service provider in terms of infrastructure, in terms of how do you prepare? There is always a limit to the capacity that you can build. How do you actually account for if there is a huge spike in the volume because of the reshoring, nearshoring? If that scenario happens, you're not able to kind of build up infrastructure on the go. There is some concept called the non-shipper concept, which becomes easy for particularly high-value commodity like pharma shipment. If you can throw some light in terms of, at least from the cargo handlers as well as from the airlines forwarders, what are some of the things? What is your ask from the shippers?
Yeah, I mean, see, if you look at the way the industry drives today, I mean, there is, of course, there are projections from forwarders, there are projections from shippers and everybody. I feel there should be a better infrastructure, especially while we were talking to Alric. We were talking about build through units, and then we were talking about own shipper. We have been talking about this for a very long time, but see what happens is India's got multiple seasons, right? I mean, you've got monsoon seasons, you've got mango seasons, and then suddenly Apple launch movements or Samsung movements. There are different movements. The spike happens, suddenly, and then we also use a lot of predictive tools in terms of how the market demand is going to be in the next couple of weeks or whatever. Based on that, we try and put some ad hoc freighters based on the demand, and how we do that. But beyond that, I mean, if I look India versus other Western countries or Singapore or whatever, the mechanism what they use is much better and much faster than the current system. So the build-through units could be will add a lot of value to the ease out the congestions. I would rather say ease out the congestions, and then it's quicker and faster for shippers, for the airport operators, and of course for airlines also. Yeah. Maybe Alric can add a few pointers here.
So basically at WFS, what we did is we did a forecasting analysis right at the start of taking over operations in 2023. Fantastic leadership from customs where through their help and the partnership with Bangalore International Airport, we were able to expand the acceptance zone itself by over 50%. What did it take? It actually took to move customs officers off the ground floor. Has it ever happened before? May have, but with such robust and speed at which customs did help us to move that helped us in our acceptance, and we increased our acceptance doors by 50% directly. Apart from that, we've gone ahead, keeping in mind that we are here for the next 13 years as per contract. We've gone ahead and bought in reefer containers, but then it's made to order for our requirements. So we've gone ahead and increased capacities. We have 20 additional other cold room facilities within the terminal that caters to different types of product. So the objective is we need to provide a level of flexibility, agility. We have done that, in good quick time. Apart from that, the Operations Excellence Department is a constant exercise. We've been constantly churning in those numbers and seeing what needs to be done in terms of future development. Touching on the topic of known shipper concept, will it come? It will surely come. How near? I wouldn't be the right person to, comment on that. Would it help? Yes, it would. Space is the biggest constraint to a lot of infrastructure facilities across India. At some point of time, we would definitely need to churn out more tonnages, more throughputs out of terminals. So it's eventually definitely going to happen. When is the only question mark. So will it help the trade? 100%. It'll change the dynamics of manufacturing, supply chain, and the way we handle products, because we always look at the Western world and say, oh, they're moving 1 million tons out of a terminal, which is equivalent to the size that we have. So how do we achieve that? We can only achieve that if we are looking at a progressive module, So a lot of think tanks will have to come together because it also deals with security and other things, which I'm sure the departments are currently working on.
Yeah, India has the ambitious target of 10 million tons by 2030, probably. Yeah. I think either we reduce the target figure or push the deadline. Maybe Harish and Ash, you want to add something related to this, Harish?
Yeah, no, I agree that BUP would, that's a good wish list, and over a period of years, this can be a reality, and I think Noida has also built that kind of facility. If you look at Mumbai is a constrained facility, but because of the advantage, what we have is we have a civil connectivity out of here. There are a lot of sectors which can be catered in an hourly basis. But what advantage of having it for Mumbai Gateway is that, is the experience and the ecosystem which is in and around Mumbai. And the fact that, our team, is constantly engaging with the shipper, like we have shippers and freight forwarders, directly engaging with us and sharing their plans in advance, so that they are able to process the cargo, even during the congestion period in a much more effectively manner. We have seen quite a bit of pharmaceutical companies coming forward and giving us plan in advance. Like, today it is like 10 days or 2 weeks in advance, but we'd like to see that coming like, 2 or 3 months plan so that we also make our resource. See, we have a facility which can cater to like, even, additional 100% of volume, because we see the management, the facilities are used only during the peak period, peak season, that's the last weekend, So most of the time it is underutilized. If we are able to sweat this asset uniformly, then, there are more efficiency which will come, and the pharmaceutical companies can also optimize it, even the airlines can optimize it. So we're looking forward for that changes coming in forward from the airlines and shippers and freight forwarders. And we have been successful in many ways. But yes, we'll work. Today's uncertainty, there is a need that, we work collaboratively with the shippers and freight forwarders, see how we can, tide this issue.
Yes, you want to add something?
Well, we are the largest freight forwarder of India. One of the key functions of a freight forwarder is to identify various bottlenecks at any point of time. And the beauty being a freight forwarder is that, you can pivot into different gateways, different stocking stations. You could adapt into a different equipment. You could change the mode, and this is what is expected out of us. For example, if there is an air space closure, how do we go around it and are able to still meet the SLAs with the customer? So these are all different things that as a freight forwarder we are supposed to do. And I think this is the biggest differentiator between a freight forwarder who's planning well in advance, who's looking at various options for customers. So whether it is shipping solutions or, for example, if something goes wrong en route, do you have a backup? We have our own equipments in terms of reefer trucks, warehousing. There could be times that something at certain airports, there could be a certain bit of an equipment challenge that you might have. You may not have the cool dollies working there. How do you pivot your customer's business to another airport from there? How could you, for example, when Israel's space got closed, and business still needed to move. So how do you create a sea air or a sea trucking solution which can get into there? So as a freight forwarder, we need to be very, very adaptive, and we are designed like that. So I think logistics companies are really designed, especially freight forwarding companies are very well designed to keep adaptability right in the forefront. And we are able to create a lot of these different solutions. Today, we offer a lot of different stocking points for customers. And I say when they look at different manufacturing options, they need to create different set of stocking options, whether it is for their raw material or for their finished products. They must be very, very open in storing it at multiple places. So various different solutions for different times, and technology needs to stay right in the front to be able to do that connectivity and give them the visibility.
Yeah, just the example of airspace closure is so important. A lot of people may not realize that the moment you have an airspace closure, you have the first thing get affected is your belly cargo capacity. So it's also important for countries to be completely neutral, so that you are friends with everyone. So you will never have your airspace closed or access to that. I have already time is up, but if there is question from the audience, I'll just take one question.
My name is Arlov John Vieira. I come from Bajaj Healthcare Limited. My question is on the dominance of pharma as far as India is concerned. Somebody made a comment. I agree, 40% of generics, US generics made by India, 31% of shipments. But India is very dominant on the pharma formulations. But our API dependence, as Reggie said, is more on China. We were exposed badly during COVID time. So my question is, on the supply chain dependability, so that our dependence on China becomes less, what steps needs to be taken? Just for your information, a small ibuprofen and paracetamol, 95% of China exports to US comes from China. Even paracetamol, 70% to US is going from China. So what should the steps be taken at the government level or at industry level for the API dominance to come back to India? If somebody can, informed panel can throw light on that.
If anybody has some thoughts on that?
Yeah, so thank you for the question. As you rightly said, in some of the APIs, China is dominant for sure. But at the same time, India is pulling back. And as you have seen from the government side, there has been PLI scheme where a lot of companies have invested a lot. Now, for example, in fermentations, India there are only countable companies. We are one of them. But China leads the front. But still, in the PLI scheme, there were a couple of companies who have invested. They are putting up a big fermentation plants, and we will be the leading market player. So steps are already being taken care, but yes, it will take some time because pharma is a very capital-intensive industry. So things cannot be built over the night, and more so since we are dealing with human lives, the regulatory compliance is very, very strict. From developing a drug to the market, it takes anywhere between 8 to 10 years. So as an industry, we have started taking steps to deal with the situation, and government is also supporting. Thank you.
Just to add here, there are companies I will not name in this forum, but big giants have started making their manufacturing unit in those countries where the tariff impact would be there. Also, they're trying to outsource the activity and different shift of model. So it's all about to compete, because who is the competitor to us in our industry for pharma is China, right? Where we are lacking is in the API, where at least like 10 years down the line to really be at par. So for that, what is the cost element of that particular API? We are trying to rework on the models. And here the government support has been tremendous, where because we are market leaders, we want to really give all those support to the manufacturers who are trying to give solutions. So if you see in next 2 years down the line, I would see the change of shift. If you see the logistic players have started putting their setup in Vietnam, a lot of other countries where nowhere where people used to think they were having a very focused area within the country or European market. Now it's all spread. So when the logistic players are moving, you can understand it's all about the demand created by our own suppliers or the exporters. So things are changing, and definitely generic will be a market leaders. We will be, but the change of model of sourcing, adaptability, and trying to work on right from the manufacturer to consumer, all these gaps can be worked together by curtailing the different models. So as he mentioned about the manufacturing cost is very heavy. So it's trying to see that there's no cost element, outsource that activity, those who are experts within that country, the tariff will be taken care of, even in the worst scenario.
I think one word, what government should do, they should do a target reforms, okay? Proactively do target reforms to address the long-term risk management. Should not be a short-term risk. This kind of uncertainties, I think government is working on that by seeing that how they realign the whole thing by giving various structuring incentives, but they should focus on target, proactively target reforms in each sectors for that matter, be it, copper, auto, pharma, garment. We are talking here only about pharmaceuticals, but you have to look at there are other industry futures which are also very critical and has a very wide reach for India, for sure.
I think the reality and the truth be told is that China plus one, China plus X is the reality, and that's the truth. But the truth is also that nothing these things can happen overnight, whether it's for India or the US. US is trying to create companies and create products and bring back the manufacturing. But you also have to see whether you have the right talent, right skill sets for all of that. It will take time. And I remember an interview with one of the MIT's Institute of Logistics professor. He said, this is the time for India, and luckily India has that window is bigger, larger, so it is time for India to make use of that. I need to wind up this conversation. It's been a fascinating discussion. I like to end with saying at the end of a shipment of healthcare product, there is always a patient. Everyone in the room can fall ill and you will need medicines. So remember that, and all of us in this room play some role in the healthcare logistic value chain, right from the manufacturing to the end consumer. You become a consumer of the thing that you produce or you distribute. I remember when my daughter was born, till the age of 5, you take oral polio, and the oral polio, the government-run agencies from the municipality, they come to distribute the oral polio. Invariably, for the first 5 years, when she took the oral polio, immediately a few hours after that, she used to get dysentery. So I went to my pediatrician a couple of times and I told this is what happens. Then he said, the polio vaccine in itself cannot cause this. Perhaps maybe the hygiene factor in which it's being administered, that could be one of the reasons. I was a journalist I was a journalist then, and he knew that I was a journalist, and he told me one thing: make sure that you don't quote me on this, because that can create a problem. With that note, remember that at the end of the supply chain, there is a patient, and all of us have a collective responsibility to make sure that we do the best in order to make sure that that patient is taken care of. With that note, I'd like to thank all my panel members, Anshul, Manoj, Harish, Giri, Amol, Yash, Dharmesh, and Alrik. Big round of applause to them, and thank you for the wonderful audience. Thank you.